Hi. Continuing with the ongoing videos around disability and sexuality, let us today talk about sexuality and cerebral palsy. Individuals with cerebral palsy have normal sex drives and desires, but they lack support in learning how to navigate the complications with cerebral palsy. And cerebral palsy is defined as a group of permanent disorders in the development of posture and movement which cause limitations in activities. Posture and movement disorders in CP or cerebral palsy are often accompanied by disturbances in perception, cognition, communication, and behavior, as well as by epilepsy. Individuals may also be struggling with self confidence in the face of constant cultural desexualization and social stigma. Cerebral palsy itself does not affect a person's sexual desire or functioning level. It can, however, limit a person's ability to use particular sexual positions and to give themselves or others pleasure in certain ways. Cerebral palsy can affect body image in ways that can cause people to isolate themselves from sexual relationships. There are uncontrollable muscle contractions, and these can interfere with sexual intercourse or masturbation and cause clamping of a woman's vaginal muscles, making penetration impossible. People with CP also have a skin and bone appearance due to disuse, dystrophy, and atrophy. In several cases, what happens is that this atrophy takes over reproductive system, causing sexual dysfunction both in males and females. And in some cases, onset of puberty can be severely delayed, retarded, or arrested altogether. Not everyone experiences the same problems, but there are some issues that can be encountered by many. These can be spasticity, difficulties in positioning, stiffness of joint muscles, problems with energy and fatigue, balance problems or loss of strength. There can be trembling, and there can be problems with the pelvic floor tone. So, when we talk about CP and sexuality, we should also talk about contraception. For women with CP, a diaphragm or contraceptive vaginal ring may not be suitable. A woman who has limited use or difficulty in controlling the movement or her arms and hands because they can be difficult to insert. The efficacy and drawbacks of specific types of contraception in CP is still an area in medicine that has not been widely studied. One should remember that finding the right birth control method is different for each woman, and sometimes it requires trial and error. It is normal to try a few options before you find the one that works for you. It requires patience and good communication between you and doctor. So never forget to consult your doctor or your gynec. And men with CP may find it difficult even to open a packet of condoms. Leave aside wearing them due to involuntary jerky movements and reduced manual dexterity. And when we talk about fertility, as far as fertility is concerned, CP needn't hold you back if your dream is to have a family. So this is a good news. You can always have a family, you can have babies. What we need to do is to start filling the knowledge gap by providing necessary amount of medical information about the intersections of CP and sex. Individuals with cerebral palsy may experience issues with balance and positioning, fatigue, or pelvic floor muscles, as I have told you earlier, along with spasticity and stiffness in their joint muscles. These issues may limit the positions or acts They can engage in or require clever solutions, which may involve using pillows and harnesses and many assistive devices. They can be used while sexual activity. When you have cerebral palsy, you need to think of unique ways to spice up your sex life and try different things to continue improving your sexual relationship with your partner. Talk with your partner about what your sexual desires are. Be open. Have a good communication. Be intimate in your thoughts and feelings. Sex is a very passionate activity. So take your time and enjoy the process from start to finish. Embrace your sexual needs and desires for what they are. It is good to take your prescribed medications before having intercourse. Since of cerebral palsy, you may have spasms and they can be pretty hardcore if they are not managed properly. Try to have set schedule in place. Scheduling and planning sex can be very important when you have cerebral palsy due to all the doctor's appointments and physical therapy appointments. Taking a sexual education class is also very important. It can be helpful when you want to become sexually active. It can also give you an idea of what to expect, when to explore, how to explore, and learn how to cope up with your sexual desires. I think it is important that you show that you are confident with your own skin and you are willing to be yourself despite obstacles and challenges that life throws at you.